we are not addressing those issues around systemic inequality that fuels, right, this behavior based on certain assumptions about what a man must do and mustn't do, right? And what it means to be a man, right? And if you're not doing this, it means you're not a man, right? So all these things are issues that we need to reimagine in terms of helping men's health and mental health. So resilience and healing. Um, I believe that we need to look at this within the context of our culture, right? So whatever that might be, in Trinidad, they like to lime a lot, that we call old talk, right? Maybe Jamaica, they won't call it liming, but, like to hang out and do different things, right? Play dominoes, right? But this might be avenues, going to the barber shop. I know here in the United States, I was a part of a group that were actually providing services in the barber shop. So as men came in there, right, we trained these barbers, right? And this was in Atlanta, Georgia, where they would listen because so much conversations happen on the chair between the client and the barber. They have a relationship, right? And he would share certain stressors and things that were going on and say, man, I hear you, did you think about so and so? This guy gave us some resources. You may want to talk to this person and so forth. So we have to find ways within our culture, right, to normalize the conversations around mental health and to normalize that mental health is a part of one's overall health and well-being, right? And begin to foster safe spaces where men can feel comfortable sharing about their struggles and not feeling like they're going to be shamed or gaslighted for sharing that, right? And that first begins with men, right? We as men have to do that in terms of addressing that context. And then for women who support their men, right? Whether it's your brother, your father, your loved one, or whoever, also providing a space where, hey, we don't look down or feel like because this man shares that means that he's less than a man, right? Or he's weak or whatever the case may be. So these are some of the things that we want to think about in regards to that. I like this picture because this is something that we do in the Caribbean, right? A lot of old talking, a lot of alignment is done constantly. And I think it's an opportunity to reframe that and help individuals to understand that these can be spaces where we can have discussion and possibly refer to the appropriate services. So call to action, we want to normalize mental health conversations among men. That is part of your overall health and well-being, right? It is no different than any part of your health. We want to push for culturally competent, gender-sensitive mental health policy. We want to address some of our archaic policies. We want to examine it in social work. You know that we are the only profession that look at policy, provide policy analysis, right? One of the things I tell my students, we just don't follow the rules, we examine it, right? And if those rules or policies are not equitable, they do not foster a growth in terms of positiveness or in terms of a strength-based approach, then we need to change that policy. Then we need to engage in advocacy and present new policies and present the data to support why we need to present change policies and how that would impact men in general, and particularly Black men, I would say, in many of our countries. So one of the things that I think it's important is emotional wellness, right? And we want to make sure that that is one of the things that we are promoting as we talk about some approaches here, right? So as you can see, emotional wellness is an awareness and an understanding and acceptance of our feelings. So how do we achieve and maintain emotional wellness? Self-care, aftercare, and integrating self-care and aftercare, right? And utilizing resources, right? Within the context, right? And that's, as you think about yourself as scholar practitioners, that's where you are right now, because you'll be soon practitioner scholars when you graduate, right? You are being trained in terms of research and finding resources and so forth, right? So it's important that we be able to talk to our clients and men, whether it's individually, the community, the family, or the nation in terms of self-care, aftercare, integrating it and providing resources. So we can't just, highlight things and then don't give people the tools or lead them to the tools so that they can be successful. So let's look at the difference between self-care and aftercare. So first of all, when we look at self-care, it's a holistic well-being, as you can see. It encompasses activities that promote mental, emotional, physical, social, and spiritual health. So that is why it is important that we reframe the notion of mental health to say that it encompasses our overall health and well-being, right? And that is coming from an African-centered perspective. We do not dichotomize ourselves as a Eurocentric view, right? We understand that we are whole being, right? And as I presented myself, you saw how many dimensions to me that make up Darren Wright, right? You hear the Trini accent, yes, but there's a whole lot to that person, right? And vice versa with individuals that we work with. Examples of self-care: engaging in activities that improve physical and mental well-being, such as exercise, healthy eating, meditation, hobbies, is a crucial aspect of self-care. And we want to continue to create new policies that promote that, right? Because that is important, I think, in self-care for all individuals, right? Vulnerability reduction, right? So self-care helps reduce vulnerability to unpleasant emotions and enhances overall feelings of well-being, making it an essential component in maintaining a healthy lifestyle. So we want people to understand things that can impact them, right? In terms of the misuse of substances, right? We have songs where scanner people talk about Molly and Pop Molly, and right? And Cartel reject that in the show, right? Cartel rejected that in his Walk to Freedom show, right? Where he talked about, we don't do that, right? So we understand that we want to help people to understand how these things impact them, right? So self-care versus distraction, important also. Purposeful activities, distinguishing self-care from distraction is vital. That means engaging in activities that generally improve our well-being rather than merely serving as a temporary escape. So surfing or, just scrolling on TikTok is not considered self-care, right? So we know a lot of people, that's what they spend their time doing. I see it. They're just scrolling on TikTok 4, 5, 6 hours. That we don't consider self-care, right? Emotional and mental health. After engaging in self-care activities, individuals tend to experience improved emotional and mental well-being, setting apart from mere distractions. And here are some examples for you. Activities like physical therapy, practicing mindfulness, maintaining healthy relationships. This is important, right? Because many men, including myself, were not taught what healthy relationships are. Even though I had my mom and dad in the home, not all of their encounters were healthy, right? And we can all agree to that, right? That each of us have our own stories, right? And sometimes we take those practices into our personal relationships and into the community, as we see, right? Where nowadays people can't even disagree without somebody coming and circle your ends and put 5, 6 in your head, right? We saw that recently with Jam Mason's son, live, right? Live on TikTok, shoot him dead. And because we are desensitized, people that's like, nothing like killing a chicken. Everything move on the next day, right? So this is the type of things that we want to address, right? So this is not only happening in Jamaica, it's happening in Trinidad, it's happening throughout the region, and definitely happening here in North America, where we see those types of behaviors. So we want to help people to understand what is healthy relationships in terms of inter and intra-group, and interpersonal in terms of with your loved ones. Because many of us have inherited practices and behaviors, sometimes intergenerational and due to stress, that are toxic and not healthy, and we need to address that and be forthright about it. So types of self-care. We talked about physical, emotional, social, spiritual, right? We cannot divorce that. For me, from an Afrocentric perspective, I know sometimes people say, well, we don't want to do the spiritual. We're not talking about religion here, because sometimes even for me, when I'm going through a stressful event, and what I say, I'm going to let go and let God, man. I have to let go and let God. When somebody's stressing me out or micromanaging me or, just doing things to undermine what you do, and you feel like, whoa, what going on here really? What is this about, I come in here with a good energy and you show up with your bad energy. I don't let God, right? Because I might just do something crazy in here, right? And I am Dr. Wright, right? So, sometimes in life, man, we have to teach people or help people to remember the spiritual side, whatever that means for them, and how they interpret that, how they could find meaning from that to address things sometimes that may seem outside of their control, right? So we want to make sure that we are helping people to address all their levels of self-care. So let's talk about aftercare. And here's the definition of that. So it's a reactive strategy. Aftercare involves strategies that individuals implement to cope with stresses and challenges after they have occurred, serving as a reactionary approach to maintaining well-being, right? Post-treatment support. Aftercare often refers to the support and activities individuals engage in completing treatment, like such as therapy, or focusing on sustaining progress made during the treatment phase. And examples of that, as we can see, if it comes to that, for some people, they may need medication. Not everyone. I wouldn't lean with that first, but if it's that, then some people may need that. Some people may need to visit their doctors more often, right? Some people may need that support, that community support circle, as we talked about, right? Having that person they could call on, that group. Hey, Joe, what's going on? You busy? I want to talk to you, brother. I'm going through some of the stress here, man. Let me talk about something. Real stress, but